dressing change on my patient. I'm going to perform hand hygiene. I'm going to confirm with 2 identifiers, the name, date of birth, or use my bracelet. I'm going to move this up to a workable height. And I'm going to ask if she's in any pain. If she's in pain, I am going to administer an analgesic 30 minutes prior, come in and reassess. Okay, I'm going to lower my railing and bring all my materials that I gathered close to me. I'm going to verify to make sure my patient has no allergies, and I'm going to do hand hygiene, and I'm going to put clean gloves on. Next, I am going to assess the wound and remove the drainage. I'm going to set up my sheet for my dirty trash, and I'm going to hold the skin firmly while removing and pulling back the abdominal pad. I'm going to note any drainage that I see and note how many gauze I'm removing. So I have 2 gauze on top. No drainage on my abdominal pad, and I'm going to note any odor that I smell. I'm going to note the type of drainage, the amount, and what kind. I'm going to remove my gauze and count how many I'm removing from the site. Okay, so in the chart there were 2 inside, 2 on top. I'm confirming that. I am checking for bogginess to indicate any tunneling. There's fine granulation tissue, and there's no drainage at the site. Next, I'm going to measure the wound. I'm going to do it in centimeters just for consistency. It is 14 centimeters in length, and I'm going to measure it at its widest point, and it's going to be 3.5 centimeters. I'm going to take a sterile cotton swab, place it into the wound at the deepest point, bring my fingers down, carefully not touching the wound during any of this procedure, because this is a clean technique, and it's going to be 3 centimeters in depth. Okay. Alright, I'm going to remove my gloves, perform hand hygiene. Okay, and now I'm going to check my solution to make sure that it is what it says it is. It's a new bottle, so I don't have to worry about a label or a name, initial, and date. I'm going to open up away from me my kit and begin to set up my sterile field. Working with my 1-inch border, I'm going to open and place down onto the table. Okay, take my sterile basin, hold it above my field, and I'm going to dump 4 to 6 inches. Okay, so this would be contaminated because it fell within the 1-inch border, but for the sake of the video, I'm just going to verbalize that. I'm also going to pour my solution into my sterile basin. It's new, I'm lipping it just to make sure there's no germs, bacteria on the end. 4 to 6 inches, I'm going to pour into the sterile basin. I'm going to hold the cap so that it reduces risk of contamination. I'm going to cover it right away and place it down. I'm going to perform my hand hygiene before donning my sterile gloves. I would use soap and water, but for the purpose of the video, I'm just going to use alcohol-based rub. Alright, I am moving on to my sterile gloves. Okay. I'm going to watch out, make sure I don't contaminate my sterile fields. Opening the gloves away from me. I have a 1-inch border to play with. Alright, touching only the innermost side. Okay, and I'm going to go under the cuff. And again, I would not contaminate my sterile fields. So, this is beyond my 1-inch border. I'm just going to move it out of the way, but recognize that it did break sterility. Now I am going to there were 2 inside of the wound, I'm gonna stretch them out and let them soak in the sterile solution. Okay, I'm not touching the sterile solution. I'm making sure there's no splashing, because anything that comes in contact with moisture is then considered to be clean and not sterile. So my fingers are not touching the solution. All right. I'm going to clean the wound. I'm going to start from top to bottom, and I'm going to use a twirling fashion, the outermost side first, and discard, and the inner side in a twirling motion, discard, and straight down the center, twirling, and discard. I'm not turning my back on my sterile field. Okay, I am using my forceps, and this is going to define my clean hand from my sterile hand. I'm going to squeeze any excess solution, and I'm going to begin packing. I'm just going to kind of coil it up so I have more control. And I'm just going to feed it into the wound. I want to pack it loosely so it's in contact with the skin, but not too tight because it needs to allow time for drying.
And I'm now going to place
Making sure my forceps remain sterile and do not come in contact with the wound itself. I'm just going to curl this so that I have a little bit more control. Okay, keeping clean and dirty separate from each other. And feed it into the wound. I'm going to take my 2 sterile gauze with my sterile hand, and I'm going to place them over the wound. Sterile hand with my sterile ABD pad, and sterile technique is completed at this time. I am going to date, time, and initial a piece of tape, and I'm going to place that on the bandage, and I'm going to use a window fashion to tape up the wound. Okay. I'm going to perform hand hygiene, clean up my mess, make sure that my patient is comfortable. I'm going to document everything that I have just performed, provide my patient with privacy, and maintain safety by lifting the side rails